features, as well as symptoms and signs, and how to protect yourself. So coronavirus is a large group of family of viruses which was existing. People think coronavirus, they refer to coronavirus, oh, everyone has coronavirus, but no, you refer to coronaviruses as the disease that's going around as COVID-19. COVID-19 was previously known, or also known as among scientists, as SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2, aka COVID-19. SARS-CoV was first found in 2002, which caused around 3,000 cases or 3,000 deaths, but a fatality rate which was much greater than SARS-CoV-2, also known as COVID-19. Coronaviruses are a large group of family viruses, just like adenovirus, H. influenza virus, Picon viruses. Now, coronavirus previously existed. Many of us in the world have probably contracted coronaviruses and usually presented with common cold. But this time around, COVID-19, which is a strain or a branch of coronaviruses, is known to cause fever as well as high temperature, shortness of breath, and even difficulty in breathing, even leading to pneumonia. Usually starts off in one person and goes on transmitted by air droplets and particles, and it usually lands on surfaces. And coronavirus or COVID-19 can usually survive up to 72 hours, which is 3 days on surfaces, and then from person to person, and then within family. And then there's been one case where coronavirus has actually been transmitted from a person to an animal or a pet animal, but it has not been transmitted from an animal to somewhere else. Mainly the people affected are on screen. So you can see the person here giving coronavirus to a member of the family, and then that person can then transmit this disease into other people in the family, like such as small kids, wife, husband, etc., and even to their parents or the elderly above the age of 60, where the case becomes much more severe and sensitive, because people in the elderly population who has an underlying condition is more susceptible to death because of coronavirus, because their immunity is much less stronger and more weaker compared to a younger person. Now, it's thought that coronavirus usually started from bats because of mutations in the virus, and then from there it went to a reservoir known as a pangolin. A pangolin is a very special type of animal found in hot tropical countries, and it's a mix or cross between an armadillo as well as a chameleon. From there, somehow the virus mutated within this animal and then traveled itself into humans. And once human contracted it, they were able to then pass on this COVID-19 via respiratory droplets through their cough as well as to other people. Usually the expected, or the WHO, World Health Organization, usually says to stand 6 feet away from someone who presents with some sort of coughing or some sort of fever or something like this, is one way to prevent you contracting the disease. Now, it was thought that coronavirus started in a small town known as Wuhan in Hubei, which is central eastern China. From there, because people usually, initially when they had this virus, they presented with fever and high temperature, they thought they had a regular common cold or a fever. So they decided to travel across the world, and somehow it spread to the entire world. And this was mainly to blame the airline industry as well as people's lack of knowledge of this COVID-19. So they traveled around the world, and somehow the virus ended up getting into different parts of the world, especially with cases the highest around Italy, America, as well as in South Korea and Iran and Central Asia. UK also coming in at very high numbers. Because of this case, now most of the countries have decided to close their borders and ban flights. Now, as of 2020, March 18th, a statistics study found in Johns Hopkins University said that there was around 214,900 cases. This is a rough estimate of a number, because this is the number of patients that's turned themselves in to the hospitals and confirmed cases, but there are suspected to be much more higher numbers, where now the government is almost saying if you have presented with some sort of symptom of coronavirus, i.e. fever, high temperature, shortness of breath, stay yourself or isolate yourself away in homes. So this number could potentially be much more higher. Now, the most cases are never counted, like I said before. A source from Imperial College London, according to the BBC, says that there was around 3,810 deaths with severe symptoms or cases at 86,000 range, and mild cases at 109,575, causing or forming a fatality rate of around 3.5%. Now, as of 18th March 2020, China announced its first day of having 0 cases, which is brilliant, because they went back in December and November when they had the first case to around January, where they were having more than 3,000 cases per day. From that to March 18th, where there was 0 cases being reported, it means that China has been doing something wonderful in order to somehow protect this disease from getting out and stop the transmission of the disease. So you can see on the screen that in January, around February, in China, there was around 59,000, nearly almost 60,000 cases as of 12th of February, and as of March, there's been a huge decline in the number of cases. Now, why is the case starting to decrease? This is because there are more hospitals available to treat this condition. People are more aware of what COVID-19 is, what the symptoms are, and there are more ventilators used because this disease specifically attacks the lungs and causes pneumonia. X-rays are used, more medical staff willing to help. Even though people have contracted disease, they've now learned how to manage the disease and manage the condition by protecting themselves to help someone else who's contracted disease. Clinical trials are being run to form a vaccine both in Germany as well as in America and in other countries as well. But there has been suspected news that some antiviral drugs could be used to decrease this COVID-19. But as of now, there is no specific drug on the market. As well as people, the general population being aware of how washing their hands thoroughly for 20 seconds every time they touch a surface, a keyboard, whatever they do, even if it's just, and not to touch their faces, eyes, and lips and nose region. Always wear a mask, self-quarantine, and stock up on plenty of food because you don't want to be in places where there's a large amount of crowd. Now, as you can see, on screen now we have a number of cases according to the age groups. On the x-axis we have the different age groups. Now the light blue colored is the number of hospitalizations that's been reported, blue in ICU, and the very dark blue known as the number of deaths. So you can see in the age group of 0 to 19, i.e. from 0 to 19 adolescents, there's been a very small number of cases being reported, even no deaths but hospitalization. And scientists believe this is because of their strong immunity power. Now, as we go across up into the age groups, we can see that the number of deaths increase as the age group increases, with a significant increase from the ages of 60 and above to 74 to 84 and 85. So the people that's more affected are the elderly from this COVID-19, and the hospitalization also increases as the age group goes. People suffering from underlying conditions such as heart disease, ischemic heart disease, or hypertension, or some sort of stroke and blight previous in their conditions, people with diabetes, people with pneumonia, these are all people with extra precautions. They need to take extra precautions because these people are more vulnerable to COVID-19 and they could end up dying because of these underlying conditions. Usually when people have an underlying condition such as these, they're on other medications which are immunosuppressants, so therefore their immune system is not working as efficiently as someone who does not have the disease. Now, COVID-19 symptoms and warning signs include fever, cough, shortness of breath, as well as persistent pain or chest pressure, bluish lips or face. The main first four ones are the ones to remember. So if someone presents with some sort of fever randomly in a day, shortness of breath, as well as difficulty breathing, please contact the emergency lifeline or telemedicine or whatever it is in order to get yourself checked out and screened for the COVID-19. Usually, once you present with these conditions, you end up having much more severe conditions. This COVID-19, the virus usually causes pneumonia. Pneumonia is a condition which is known as inflammation of the lung parenchyma. We're not going to go into detail of in this video, but the worst outcome of COVID-19 is it can cause pneumonia and then lead to septic shock as well as fatality, which is known as death. Now, imaging features of COVID-19 mainly aimed at radiologists as well as other people. The main thing that they're using now in clinics and hospitals are CT scan as well as an X-ray. On CT scans, you can usually see ground glass opacities as well as consolidation in the periphery of the lung parenchyma. So you can see ground glass opacity, which is a white shadow type thing, which is not meant to be there on a normal lung. A normal lung is meant to be completely filled with black. So where the mouse is pointing to, the yellow shows ground glass opacities as well as here where my mouse is pointing to. On the X-ray, you can see somewhere here in the right lung, in the right lower fissure. So ground glass opacities as well as interstitial. Now, the third sign is, so we have consolidations, ground glass opacities, combined with interstitial and interlobar septal thickening. So these are the main findings on radiological aspects. Now, someone cannot be just diagnosed with COVID-19 because they come into your clinic with shortness of breath, fever. They could be suffering from pneumonia. They could be suffering from other viruses such as adenovirus or H influenza. So to exactly differentiate and pinpoint COVID-19, you would also have to do a laboratory test such as a blood count or an increased WBCs, leukocytosis, as well as other inflammatory markers. Now, as the disease progresses, you can also see more of crazy paving pattern. So the consolidation or the ground glass opacity usually spreads into the different parts of the lung, causing a crazy paving pattern, and it becomes more consolidated and more fibrous and more scar tissue. But this can eventually resolve itself. So the body usually, once the virus has been somehow cleared off from your body, the lung returns to its normal capacity function. Now, ground glass opacity lesions in the peripheral, so you would obviously see the main findings are in the peripheral and the posterior lungs on CT images. Now, CT scan, X-ray, as well as WBC count using blood tests are a good and very sensitive way to detect COVID-19. But real-time PCRs is one other way which can be used to detect COVID-19, and it's much more sensitive because in imaging features or radiological features, like I said before, influenza and adenovirus presents with the same type of imaging. Now, usually when someone coughs in the area, how does it spread? So one person coughs, the coronavirus leads to person to another person in the family, and it can go from an affected area to what's known as a non-affected area because the person might travel to that area to see their family members or a friend or a family. And from that family member, it can then travel into a local town, which is known as local transmission. So person to person transmission, then it goes in a non-affected area, and then a local transmission to the population. And then once a patient gets affected, it can then go further into the hospitals, affect the nurses or doctors or the healthcare system who might have family at home, such as kids and children, who can then go into schools and stuff and cause further spread of the disease. Hence why the government has implicated that all schools or public gathering areas should be shut, such as schools, weddings, as well as football matches, basketball, and any stadium or gyms and everything, and pubs and restaurants in the UK, as well as other areas. Now, the steps to prevent, there are 7 steps, but I've already highlighted 4 steps on screen, the main ones. Wash your hands frequently, around 20 seconds. Avoid touching your eyes, nose, and mouth at all times. And avoid crowded places and close contact with anyone that has a fever or cough. And you can do this directly by wearing a mask. If at any point you feel as if like you've contracted the disease, try to self-quarantine yourself in the house. And if you have more than one person living in the house, you need to self-isolate yourself in rooms. Try avoiding using or sharing utensils such as plates, knives, forks, stuff, and avoid contact with people at all costs because you do not want to be the one that's spreading the COVID-19 to other person. And don't use shared toilets, or even if you do, clean before using the toilet. Now, if a person usually contracts the disease, there's what's known as an incubation period. And then once after the incubation period, they then become a carrier or a transmitter. A carrier is someone who has a disease, so they have COVID-19 and they can give it to other people. Sometimes a carrier can be symptomatic or they can be asymptomatic. And usually the symptoms only present themselves. So post incubation period, there's 5 days for the symptoms come. So the symptoms include fever, shortness of breath, difficulty breathing. And then after the 5 days of symptoms, once these 5 days have passed, that's when the patient really becomes ill and severe and end up in hospital for a ventilation or something like that. Usually the treatments include supportive care, ventilatory effects, as well as fluids and oxygens. There is no current vaccines available in the market as of 2020, but there are talks being made from other companies and various different clinical trials being run. As of 2021, there might be vaccines available on the market. So that brings this video to a conclusion as of March 2020. So around the world, in China especially, there's been a decrease in number of cases. Most of the countries in the world have sealed off their borders. People are trying to stock up on foods and everything from shops and everything. If you feel as if like you have COVID or some sort of fever, try self-quarantine yourself at home. You can always call the 111 or as well as the 999 if you're in the UK, if